Hi, I'm Phil Day. I'm the Superintendent Pharmacist at Pharmacy to You. You'll have heard a lot about Strep A in the media recently, so I'm here to answer some of the top questions you might have about the condition. Strep A, which is short for Group A Streptococcus, is a group of bacteria that can cause a range of infections, ranging in severity from mild to severe. These include throat infections, scarlet fever, or skin infections such as cellulitis or impetigo. Strep A is spread through close contact with an infected person and from coughs or sneezes. Some people can carry it without feeling unwell but can still pass it on to others. The main symptom to look out for is a sore throat. Not all sore throats are caused by Strep A, and children can often experience this from other viruses which will usually clear up on their own within a few days. However, children who have a sore throat caused by Strep A may develop other symptoms which can include a headache, a fever, muscle aches, swollen neck glands, red and swollen tonsils, pinkish or red body rash with a sandpapery feel, red and white patches in the throat or on the tongue, which can make the tongue look a little bit like a strawberry, and the tongue may be swollen, trouble swallowing, lower stomach pain, loss of appetite, nausea or a rash. As a parent, if you feel that your child seems very unwell or you suspect they have a Strep A infection, you should trust your own judgment and contact NHS 111 or your GP. Good hand and respiratory hygiene are important to stop the spread of Strep A. The risks of catching it can be reduced by washing hands properly, using a tissue to catch coughs and sneezes, and keeping away from others when feeling unwell. Most cases are mild and easily treated with a course of antibiotics, and if they're prescribed, it's important to finish the full course. If you think your child might have a Strep A infection or scarlet fever, it's important to act as quickly as possible. Early treatment with antibiotics is important to reduce the risk of complications such as pneumonia or a bloodstream infection. As a parent, if you feel that your child seems seriously unwell, you should trust your own judgment and contact NHS 111 or your GP if you're concerned, particularly if you suspect your child has scarlet fever, if their symptoms are getting worse, if they're feeding much less than normal, if they've had a dry nappy for 12 hours or more, or show other signs of dehydration, if your baby feels hotter than usual when you touch their back or chest, or they feel sweaty, or have had a fever for more than 5 days, or if your child is very tired or irritable. And you should call 999 or go to A&E if your child is having difficulty breathing, if their skin, tongue or lips are blue, or if your child is floppy and won't wake up or stay awake. For further information on Strep A, there are several online resources available, such as the NHS and government websites, or you can ring 111 or contact your GP if you